Meghalaya Chief Minister Conrad Sangma virtually launched a transformative healthcare initiative, the 10-bedded ICU project in 12 district hospitals and 2 tele-ICU hubs. Sangma highlighted the project's significance in addressing critical care challenges in rural areas through cloud technology, connecting specialists to ICU wards. The online telehealth platform facilitates real-time data for effective patient care. The Chief Minister expressed gratitude to eGov Foundation, Karuna Trust and donors for the impactful contribution to healthcare in the state. Health Minister Dr. Maisel Amprinlingdo, Principal Health Secretary Sampath Kumar and other officials attended the launch.
The health sector is going through a huge transformation as we speak today, and we saw a glimpse of what that can do. And technology is going to play a very, very vital role, especially in providing health services, and especially in regions like ours, which is very, very disconnected and a difficult terrain that we have in our state. And therefore, just to give a simple idea to you, that apart from what we're doing in care, the technology that you've seen, I think some of you understand the depth of that technology, but we want to go further into that and be able to micromanage details of every patient in the state today. And we are moving towards that. And this data, this information, as you know, will allow us to capture the actual scenario that's happening at the grassroots, analyze it and be able to create predictable models as to what we need to see happening in the days to come. And obviously AI will play a very crucial role in being able to really implement the data that is there and create those predictable models and allow us to then be able to take policy decisions as to how we should change things and improve things to have a better impact on the overall healthcare sector for our state. So this is a very, very important stage, and what we are seeing that's happening today in terms of the 10-bed ICU that's coming up. Some of you might just think that this is just an ICU that's coming up, but this is much more than that. There is a lot more going on beyond what meets the eye, where yes, through the telemedicine, we will give the healthcare services, but while we do that, as I said, we are creating a massive database, a massive predictability model, and AI being part of that will allow us now to transform and be able to create a better preventive medication system in the coming days. And that's what really is the most exciting part about what technology is doing in the health sector. And I'm sure that this will have a huge impact in how we do things in the future.
The state of Meghalaya has a very big strength, and that is our nursing fraternity. So much of lives are saved because our nurses rise to the occasion and save lives in real time, real situations, in the most challenging of locations. At this point of time, it is but natural for me to once again call upon our nursing staff, our doctors, to work together in a project which involves the community. Community involvement is a mantra in the state of Meghalaya. We are indebted to all related to this community work that we have begun in the state of Meghalaya. In a very important indicator such as the mother mortality rate, communities have proven beyond imagination that they can support government in saving lives of mother during childbirth. We are indeed very, very happy to see that now that we have a very strong base, we can get into bigger things with the involvement of technology. I would believe that when you implement technology in healthcare, you are truly able to bring treatments closer to the people. The hub and spoke that has been discussed by every expert who has spoken before me goes on to lend valuable insight, and that is we can save lives every time we utilize technology in our efforts. The state today has serious issues with cancer treatment, serious issues with kidney failure treatment, serious issues with NCDs or the non-communicable disease treatments. And this is where technology can be utilized very valuably to save the lives of individuals. There has been this discussion about artificial intelligence, and very often as laypersons, this term brings fear to our minds. But today we have seen that this technology will enable us and strengthen us as a community, especially in areas such as healthcare. There will be a need to have a collaborative review of policy if we have to ensure that we track patients from wherever they are, whichever institution that they have been treated, and connect them when there is a critical situation. I know that this is possible because just very recently, the leader of Makurwat Civil Hospital is here. They were able to perform a big surgery in as remote a place as Makurwat. Nothing is impossible. It is just the mind, it is the approach, and at this opportunity given to us by the bureaucracy who have understood all the gaps in health infrastructure, I appeal to doctors, nurses, paramedics, rise to the occasion, join hands, and fear not. Correct, we have to ensure that SOPs are maintained. We cannot be found lacking in the maintenance of our SOPs because lives of individuals are very, very valuable in this entire chain of cloud-based technology.